We are back with our Ask the Doctor segment. You can call into our phone lines at 334-420-9732 to ask your medical question to Dr. Brian Sellers. Dr. Sellers, we have some callers waiting on the line right now, so let's go straight to them. We have Diane in Plantersville. Diane, go ahead with your question for Dr. Sellers.
Good morning.
Good morning.
I have vascular disease in my legs. What can be done for that?
So when you say vascular disease, do you mean blockages in the arteries or do you mean issues with your veins?
Like reflux.
Reflux, okay. So reflux is usually seen more on the venous side, and that usually has symptoms like leg swelling, heaviness, fatigue. Some people can get restless and cramping at night, those kind of things. So the basic treatment usually begins with leg elevation and compression of some sort. So over-the-counter compression socks are a good place to start. And that's the beginning treatment. But there's some ultrasounds you can get to check the reflux, see how bad it is. And sometimes we could do procedures to get rid of some of the veins that are not functioning properly.
Thank you for calling, Diane. Let's go to Edward now in Montgomery. Edward, what is your question for Dr. Sellers?
Good morning. My doctors have an iron deficiency, and although I'm on medication, he's recommending IV once a week for 5 weeks. Can you tell me, is that the best treatment for that, or is there another treatment besides the IV?
Right. So it's probably, it's hard for me to speak on things I haven't evaluated, but I would say that if he's recommending IV iron infusions, you probably have a pretty significant iron deficiency, probably one that he's concerned might be more difficult to overcome than just giving you iron pills. So that's probably why he's recommending the IV.
Edward, thank you for calling. Best of luck to you. I'm not a doctor either, but I will tell you IV iron was life-changing for me. So if your doctor recommends it, it could do the same for you. And I know you're probably feeling pretty exhausted. So best of luck to you, Edward. Let's go to Amy now in Pike Road. Amy, go ahead with your question.
Hey, Dr. Sellers. Thank you so much for taking my call.
Hey, Amy.
I had sclerotherapy 17 years ago, and it's pretty much time for me to do that again. And I was wondering what your office offers with respect to sclerotherapy for spider veins.
Sure, we do sclerotherapy. We've got one of our nurse practitioners who's very good at that. So we're happy to evaluate you and get that set up if that's what you would like.
Okay, does it require an ultrasound prior to the treatment, or can you just come in for the treatment alone?
It depends on your symptoms. Or it depends on what the veins look like. If you don't have big ropey varicose veins and it's just spider veins, then you don't necessarily have to have an ultrasound before that.
Okay, great. Do you have any information as far as the charge? Does it depend on the degree of the vein involvement?
Right. I don't want to tell you the wrong thing. So we can get you in contact with our lady that does the billing and coding, and she can give you an exact price. But if you want to talk to one of them, the phone number is 334-246-4774.
Amy, thank you for calling. That treatment that you're talking about, Dr. Sellers, the one she's asking about, what does that entail? What's that treatment like?
Sure. So when people get spider veins, just little clusters of very small veins on the legs, you can have sclerotherapy where we inject through a very small needle a medication that causes those spider veins to essentially clot off. And so basically, once you inject them over the next few weeks, those will become less and less prominent. And a lot of times they almost completely disappear. But they have to be very small veins. If they get to be bigger veins, that medication is not as effective. But it's a pretty simple procedure. Usually we do it in about 30-minute increments, and there are limits to how much medication we can inject at one time. So sometimes if your spider veins are really bad, it takes multiple treatments. But it's pretty straightforward. We just we inject them, and they get better over the next few weeks.
We had some great questions today, Dr. Sellers. Thank you for joining us. If folks want to come see you at your office, what's the best way to get in touch with you?
Call the office, 334-246-4774.
Dr. Sellers, thanks again. We appreciate it.
Yep.